All right. So we are happy to have Natalie here today. She is going to be giving us a lot of good information about speech therapy. What is speech therapy? How to know if your child might benefit from it. Some things that because I think there's a lot of more to speech therapy often than just speaking. Teaching kids how to talk. So different avenues you can go through with it. I don't know if you have a good speech therapist. So a lot of good information. I'm gonna let Natalie take it
Sounds
away.
great. Thanks for having me tonight. I
Yeah.
am just going to share my screen so you guys can see what we're talking about as we go. Um, but I'm super excited to connect with you guys. I think one of the really awesome things about being a speech therapist is being able to collaborate with families and parents and work with the kids. So it's really great to have some families involved in this conversation as well. So today we're really talking, one of the things that we talk about in speech a lot is answering questions. So we're going to hit those big important questions of who, what, where, when, and how we navigate speech therapy, specifically in relationship to autism as well. So a little bit about me. I have been a speech therapist since 2007. To be a speech therapist, you have to have a master's degree. So most of us have an undergraduate degree and then a master's degree as well. So I did those all locally here in Illinois. I have worked in a variety of different settings. I've worked in public schools, working with mostly elementary, preschool through elementary age. I've worked in hospital settings. I've worked in therapeutic day schools specific for kids with autism, an autism clinic. And then recently, not super recently, within the last 4 years, I opened a private practice, Cooper Therapy Connections, and we see kids of all ages there. So we'll chat a little bit about experience and how different work experience and school experience can make for different types of SLPs. So what I wanted to talk about first is what is speech therapy? Because like you said, Rachel, it can be very misconstrued that we work on just working on sounds. I think that's a very typical perspective. A lot of people think, oh, they work on R's and L's, and that's what we do in speech therapy. That is one tiny little piece of what we do in speech therapy. When we go to school to become a speech therapist, we are trained in all ages. So from birth to death. So we work on feeding, we work on people that have had strokes, we work on different language skills. We, of course, work on those R's and L's, but it's a very broad schooling that we get. So we're going to talk about pediatrics so that it's relevant to you guys. And we're going to talk about the things that mostly impact the kids that do have an autism diagnosis. I want to make sure that we talk through different terms and lingo that you'll hear speech therapists use, so that way when you are talking to other therapists or other parents, you have an understanding of what those terms are that we generally use. The first one we're going to talk about is expressive language. So that is how we as individuals express what we want, what we need, what our ideas are. That is something that can be very challenging with kids with autism, how they get their words out, how they sound when they come out, and making sure that our kids are getting what they need when they communicate. The opposite of that would be our receptive language. So what are we understanding as an individual? Generally, this is talked about within verbal language. So if, for example, a parent is asking a child to go get their shoes or put away, their backpack, we have to have an understanding that the kids understand those words that we're using, the vocabulary that we're using, and understand what to do with that information. So when we talk about receptive language, that's going to be all of the input that the kids are getting and what they do with that information. Another area that we often talk about is pragmatic language, which can also be called social language. And this is how and why we use language. As neurotypical adults, we use language to communicate, to tell stories, to tell people how our day was, to socially greet people when we're out at the store. So all of that reciprocal conversation and why, what's the purpose of conversation is something that we often have to teach our kiddos on the spectrum. we want to make sure that, you know, that purpose of why we communicate is something that they can tap into. Articulation and speech intelligibility, that's our speech sound development. And this is what people generally think of when we talk about speech. Are the sounds coming out like they're supposed to? Do we have a full repertoire of sounds? Are we able to use all the sounds and the different parts of words that they come out? This is something that is with all types of kids, but we do see a lot of kids on the spectrum that have troubles with these sounds for a variety of reasons. So that's something that we'll talk about and what that would look like in therapy as well. Another thing that speech therapists can work on is feeding. We have kids that might have difficulty swallowing. Their structures in their mouth or their throat are not working correctly for some reason. I know there's a lot of picky eaters out there. That's something that we can tackle as well. There's a variety of different reasons that the kids might not be consuming the foods that we need to. So that nutrition piece is important as well, to make sure that our kids are eating a variety of foods in their diet so that way they can thrive and be healthy. So all of these things really fall under that speech therapy umbrella. Some kids may have one or two of these areas that need support. Some may need support in all of these areas. But all of these things are things within our scope of practice that a speech therapist would support children with. So one of the things that I want to talk about when it comes to speech therapy, there are a ton of buzzwords out there right now. Speech therapy, just like any other therapy or educational program, they're constantly evolving. There's lots of research being done to look at what is best practice to support kids and adults. And it's really tricky, I think, for parents to keep up with what are the best things that my kid needs, because it's going to be different for every kid. And I think in the world of social media, for example, there's a lot of information at people's fingertips, but knowing what to do with all that information and what it all means and how it relates to our kids is something that is really critical when choosing a good speech therapist or what type of supports your child might need. So on the slide, I just threw out a couple of the really popular buzzwords that are happening right now. Some of them are different terms for things that have been around for 100 years. And then some of them are new things. So things like, we'll start up at the top with the Gestalt language processors. This is a pretty recent term that's being used right now in the world of speech therapy and autism. It's a concept that has been around for a very long time, but now there's a name for it. When we talk about typical language development, generally you think of like, what is your child's first word? And then you come up with a list of maybe 50 words that they have learned, and then they start to put those words together. So it might be dada is a first word, a very common first word. And then a few weeks later, you might hear the word milk or the word ball. And then eventually the kids will start to say dada milk, and they'll start to put those words together. So the idea is that kids are learning words in single elements and they learn how to put them together. These Gestalt language processors are doing the opposite. They're learning chunks of words and then having to break them apart to create novel thoughts. So something like, I want a ball is maybe one thought in a kid's brain that's a Gestalt language processor. So they're learning in a very different manner. So when it comes to choosing a therapist or what kind of therapy is important for my kids, you want a speech therapist that's familiar with all of the different types of language processors to make sure that you're getting the best fit for your child. Another area, and this one falls a lot in with the realm of ABA, it's something that speech was borrowed from it, is discrete trial. Learning things in a very systematic method is something that happens a lot in ABA, and speech therapists have adapted some of that to work in a different vocabulary, following directions, different skills like that. Social thinking is another concept that speech therapists often use. Another technique. Social thinking really works more with our highly verbal kids that are learning different social skills, teaching kids that other people have thoughts about them and what they do impacts other people. So that's a strategy that you might hear a lot of speech therapists refer to as well. AAC, or assistive and alternative communication, is something that we use with our children who may be more minimally verbal or not have as many expressive words. There are different technology supports that we can put in place. Some are technology, some are low tech. So things like picture boards. PEX is another one on our screen here, where it's different pictures that kids can use to communicate. So those kind of go hand in hand, those PEX and those AAC supports. Play-based therapy is a really big hot topic right now. And we do that a lot with, it kind of goes along with the Gestalt language processors, using play and using highly preferred activities for kids and pulling language out that way is a technique that a lot of therapists are using. And then prompt is another one up here. That one is more specific towards our kids that have difficulty with their articulation, getting those sounds out. It's a tactile strategy that therapists can be trained in to help teach kids exactly how to produce those sounds that they're maybe missing. So these are just some examples of the terms and the techniques that speech therapists can be trained in and may use in therapy. What's super important as we talk about this is just because one child might be needing social thinking support or one child may need PECS, it doesn't mean that all of the kids need those things. So as we're doing research as parents, just because it works for a friend or a neighbor, we want to make sure that we're finding a therapist that can help find the best fit for you. So that leads us to our next thing. How do we know what's best for our kids? How do we know which strategy or which tool might be the best thing? So that kind of goes along with who do we want to pick for a provider for our child, a speech therapist that works with our child. So I thought the best way to go through this was to talk about it in what is important and what's not important. Some of the things that is not important, but I've heard some parents put a lot of emphasis in, is the age of the therapist. We know that some therapists are fresh out of graduate school. They may not be parents yet. They may be young. They may be fresh out of graduate school and be 45 years old because they had a career change. But I've had some parents that'll say, I don't want a therapist under the age of whatever. You may be missing out on a really good fit if you come in with those limitations of this is not a good fit for my kid. Sometimes doesn't matter, sure. But we don't want that to be a hard, fast rule that a brand new graduate is not a good therapist, because there are a lot of fantastic new graduates that can work with your kids. And there's some perks to it too. Therapists have to go through tons of hands-on. They spend about a full year of their training in graduate school working with experienced therapists. So, while they're new graduates and they may be younger, they've had a lot of experience that we might be missing out on if we rule out that right away. Another thing that I think is really important to highlight in the current world that we live in is the social media presence of a therapist. There are a lot of really great Instagram SLPs and Facebook SLPs, and they share lots of information, and it's good information, but that doesn't necessarily mean that that's the best therapist for you. There's a lot of other things we'll talk about on what is important. So I don't want people to get hung up on like, oh, I saw them on Instagram, so they must know what they're talking about. One of the biggest things for me is the limited willingness to trial a variety of strategies. So we know that our kids are complex and they're constantly evolving. So we want to make sure that we have a therapist that's willing to try new things, willing to explore different avenues when something stops working. I think that's something that I'm seeing a lot now with all of these buzzword topics, is that there are therapists that are trained in XYZ, and that's the only strategy that they'll use. And sometimes that works great, not always. So we want to make sure that we have someone that's flexible and open-minded to be able to adapt with the needs of the children. So what is important? The most important thing to me is the connection that the therapist has with the child and with the family. We know that we don't all jive with other individuals the same way. Does that mean it's a bad therapist? No, but it might mean that it's not the best therapist for your child. So we want to make sure that the child feels comfortable and that the family feels comfortable with that person, because once you find a good therapist, it's a therapist that will hopefully stick with you and your family for years. I can say I was just chatting with one of my families earlier this week. I have a handful of kids that are in high school, some looking at college, and I've been with them since they were 4. So it's definitely one of, you become part of these families. So you want to make sure that this is a connection that is really important. That kind of goes along lines with the variety of expertise and trainings that your therapist has gone through. Like I said, you want somebody that's able to adapt to the needs of your child. Some of these kids that I have been with for the duration of their life, when they were 4, we were working on very different things than what we're working on now when they're 16. So having that background of the different trainings and learning different skills to be able to support these kids as they grow and evolve is super important. Experience. So like I said, when we are in graduate school to become speech therapists, we learn a lot of different disabilities, different strategies, different ages, and eventually we all kind of specialize in a certain area. I had a family member who had head and neck cancer and had difficulties with swallowing due to radiation. They called me and said, what do I need to do? And it's like, I haven't done that in 20 years. So let me connect you with the therapist that is skilled in that area. That's not something that is in my expertise any longer. So you want to make sure that you're connecting with a therapist who is skilled with the age that you're working your child is, and the skill set that they need. There are certain things that a family would call and say, can you help me with, voice, which would be something that I don't really work with. So I would make that referral. So you want to make sure that you have somebody that is confident in their skill set and can make a referral when it's an area that is not something that they're as skilled in. Another thing, as we kind of talked about that age, there's a lot of other experiences other than trainings in school that therapists have. We don't want to rule out life experience. There may be a therapist who grew up with a sibling that has autism, and they've got a whole different perspective than somebody that maybe doesn't. So counting into account those other factors that might be something that is not schooling and not training, but relevant to the situation. Another great place to seek information is referral from somebody that you trust. Maybe it's neighbors or friends or family members that have kids that have similar needs, and looking for them to who's worked well with your kids. Who was a good fit for you when your child was in middle school versus elementary school. So really, relying on people to make those relationships. And then another big one is willingness to collaborate with other professionals. We know that our kids have lots of different kinds of needs. We might have kids that are in school and they're in ABA and they're in occupational therapy and they're in speech therapy. We want to make sure that we have somebody that's willing to be a team player with all of those parties. There is so much that I've learned from different providers and that I've been able to help other providers with, so that way we're all collaborating and supporting the kids together. You don't want a provider who's going to say, I don't play well with others. You want to make sure that they are willing to collaborate and seek information. I'm not an OT. I've worked with OTs for a lot of years, and I've learned some really great sensory strategies, but I'm also still always learning. And that collaboration is going to be in the best interest of the kids. So moving on to our next kind of hot topic is, where do we go to get speech therapy? So there's actually a lot of different answers to this question. And it's going to depend, the primary factor is going to depend on the child's age. There are different therapies that kids can access at different ages. So if we're talking about our really little ones, kids from birth to their 3rd birthday, the state of Illinois has a program called early intervention, and that's something that we can access within those first 3 years of life. Early intervention has a variety of therapists, occupational and developmental and speech therapy. A speech therapist through early intervention, generally they come into the homes of families and provide therapy at home. Not always, but that's the vast majority of it. They work with a ton of different insurance companies. They are able to support families in different financial needs. One of the hard things with early intervention is there is a hard stop on the 3rd birthday. That kid is done, and therapy ends through that program at that age. So that is, I find that that's sometimes difficult for our families of kids that are presenting delays a little bit later in life. Their first year, they might look very typical. And then it's, sometimes a year and a half, 2 years where parents are noticing, okay, maybe something is going on. And you've missed that window of time. So by the time you actually get started with therapy, it's very short-lived with this early intervention program. That being said, it's a wonderful resource when you're within that age group. Once the child turns 3, they can access services at school, whether or not the children are enrolled in school. So at that 3rd birthday, sometimes if you've been in early intervention, they'll help you transition to school therapy. And that might be in a classroom setting, a preschool classroom, and the therapist can go into the preschool classroom or pull them into an office. I've worked with kids when I was in public school where they're not enrolled in school, but they qualify for therapy. So the parents would bring them to school for a half hour a week and they would get therapy at school. And then the parents would pick them back up and they would head home. School services are through the time children age out of school. So their 22nd birthday. This would be through an IEP, an individualized education plan. Often it's not just speech therapy. They might also be able to access other kinds of therapy or special education services as well. And then a completely different option is private practice. And there are several private practices in our area that specialize in a variety of different things. They provide a bunch of different services. Sometimes they're in a physical building in a clinic. Sometimes therapists come into the home. We've even done and my agency does this as well, where we will go into a daycare or into an ABA center to provide therapy there. So there's a lot of different options within that private practice. Generally, private practices either take private pay or insurance, depending on what each clinic offers. And some private practices will specialize in ages. Some work with all ages, but there are clinics that are for all ages. For example, the clinic that I run, we see kids from about 12 months, and then we have some college age students as well. So we have a huge variety of services there. So when do we begin speech therapy? The ideal answer is as soon as you notice that there's something going on. So early intervention is key. It's something that research has really shown the sooner that we support kids that have needs, the better successes that we see. It kind of goes along with the concept that play-based therapy is really supportive for kids. That early intervention, when we think of therapy, we think of sitting at a table, doing flashcards, very, regimented kind of activities. But early intervention supports are on the floor, playing with the kids, engaging in their preferred activities, and teaching that language and how to get the language out of kids that are not expressing. There's a lot of providers that support communication. If we really think about communication, that's everything everybody does all day, so it's how we listen, how we understand vocabulary, how we communicate functionally. All providers are teaching communication if you really look at it. OTs are helping kids communicate what their sensory needs are. Developmental therapists are helping teach early academic skills. ABA therapists are helping teach language versus behaviors. So everybody is working on communication. But it's important to really pull in a speech therapist that has specific direct training to support that team of professionals that the kids are working with. So even if you're receiving ABA therapy or developmental therapy or other therapies, if there's a problem with communication, you want to loop in a speech therapist. One of the most important reasons as to why is a lot of times we see different comorbid factors. Yes, the child may have autism, but there might also be something else going on that is something specific a speech therapist needs to be involved in. Kids could have verbal apraxia, which is a motor planning issue, and having the brain send signals to the mouth on how to make words. Some kids have lip ties or tongue ties that might need specific, possibly dental or ENT support, but a speech therapist would teach muscle strength and different activities so that those things don't regenerate after a surgery is performed. There may be hearing loss that needs to be treated in a different way. or the kids might require some assistive technology, which would be specific in the realm of speech therapy. So there's a lot of things that could also be going on that we need to look at in a tighter lens through a speech therapist versus some of the other providers that you might see. Like I mentioned earlier, therapy may evolve as kids grow. So it might be at 2 or 3, the kids are communicating and we don't see a lot of speech concerns. Again, if we think about speech in the realm of teaching R's and L's and speech sounds, a child might not need that early on. So parents don't necessarily think we need to involve a speech therapist. It might be that my child is, throwing when they're frustrated. So I think I need behavior therapy, but really that might be a communication issue as well. So we do see kids come to speech therapy later in life as parents start to realize that maybe there's some communication differences here that we need to address. So it's never too late to get started. I talk a lot with families when they're 12 months, 16 months, and they've got concerns, but we also get kids that are 13 and starting speech therapy for the first time. So there's no hard and fast timeline where we need to, you have to be in therapy by this certain age. It might be that kids' expressive and receptive communication looks really good, but we hit teenage years and now there's social things that we need to worry about. And so learning those social communication skills are something that we didn't have to think about when they were 4. So we do see kids of all ages start therapy. So I don't ever want parents to feel like we missed the boat, we should have done this, because it looks different for each age. So these are, I'm not going to go through all of the specific things, but these are a lot of the warning signs there may be a language disorder in kids. This came right from our ASHA is like our National Board of Speech Therapy. And these are on their website. They have tons of great support. So if a family's ever looking for, how do I find a speech therapist in my area? How do I know that there's a problem? They have great things on their website for just information. But some of the big things when we think about our really little kids that could be signs of a concern is that you've got a baby that's not really interacting, not smiling, not cooing, not babbling, very quiet. I always kind of cringe as a therapist when I hear parents say, my baby's so good, they don't make any sounds. As a parent, I've been there, I've got 2 of my own. The nights where they're sleeping and they're quiet, it's wonderful. However, as a speech therapist, we want kids to be making noises and interacting and making sounds. So when those parents are like, oh, my baby's so good and quiet, there might be something going on. Babies that are not making gestures like pointing or waving, those are things that we look for when they're really little, expecting to use language. Those are signs that there might be something else going on. As we look at kids that are a little bit older, 1.5 to 3 years, if they're not putting words together, maybe they're just only using one word or not any words, that could be a sign of some concern as well. The end of the slide, we'll get to it. It's different things that parents can do at home. So we'll get to that. I've got another slide on that later. Looking at those sound disorders, this is a very kind of clear cut. At certain ages, kids should be making certain sounds. So if we think about, I think all parents are very familiar with developmental milestones. So, at what age does my kid sit up? At what age is my kid supposed to be crawling? At what age do they take their first steps? Those are very common. We talk about those developmental milestones that kids at about this age should be doing. Speech sounds actually come in the right way. So if you think back to when your child was a year old, they're making some sounds, they're talking, you don't understand a lot of it, and that's okay, because when they're 1, we're not expecting a lot of speech sounds to be coming out of them. As kids get older, we should be understanding more and more. So if you have a child that is 3 or 4 and most people don't understand them, that's a sign of concern. I always tell, especially moms, you're going to understand your child way more than anybody else does. You're with that child, they're your baby, you understand what they're saying. So it's very common that we see kids come in for speech therapy and the moms say, well, I understand everything, I don't see a concern. Grandma or the neighbor or myself as a trained listener, we don't understand the kids as well. So I always say tap into extended family that might not see the kids too often, see what they can understand. And if by 3 or 4 years old, if they're having a hard time understanding their speech, that's definitely something that you want a speech therapist involved in. So the super big important question is, how do we help our kids at home? I know that right now it's really hard to get into therapies. There's lots of wait lists everywhere. There's also lots of places with openings, so don't give up. But we want to make sure that at home we're connecting and supporting the kids in their language the best that we can. So the most important thing is, if your child is in speech therapy anywhere, at school, in early intervention, at a private practice, make sure you work with that child's speech therapist so that you can carry over very specific skills that they're learning in therapy. There might be different techniques or different strategies that you can pick up from that speech therapist to work on that your child's individual needs. When we talk about speech, like I said, there's a million different goals and areas that we would focus in. So your child will have very specific goals, and we're generally targeting them in a systematic way. So what you're doing at home for your child might look different than for somebody else's. A good way to learn these things is to ask to participate in therapy sessions periodically. I don't think you need to sit in and be in every speech therapy session, unless that's other than a reason that maybe your child's really shy and needs mom in the room, or the sessions are maybe happening in home, you're around and you're observing. But if you're in a clinic, definitely ask to sit in on some sessions. I do have some families that when you're in the session, we want to make sure that we're participating in the session. I've had some families that sit in and they answer phone calls or they're on their emails. That's not beneficial to your kiddo, but be in there, be engaged, and learn from the sessions that are going on. Some general supports that I think help all kids is using functional language. So this is another thing that I hear lots of families come in for therapy, or even family members of mine with their young kids. Very often I'll hear families say, they're really great. They know all their colors, they know all their ABCs, but I can't have a conversation with them. So learning the labels of things is great. It's important. We all need to know that, the color red is the color red. However, if we have language concerns, functional language is extremely important. I have parents that get really frustrated sometimes where they're like, but they still don't know their colors. No, but they can ask you to open what they need to be open. They can ask you for help. They can ask you to reach something that's out of reach. So we want to make sure that we're really hitting that functional language, especially for our kids that get frustrated. We don't, the goal is that we use our words and that we use our communication and not behaviors, right? So if I'm really frustrated because I want this juice box that I've been working really hard and it's my favorite juice box and I can't open it, it doesn't matter that the straw is yellow. What matters is that I need to be able to say to you, please open my juice. So that functional language is super important. Don't ignore the other stuff. Don't ignore colors. Don't ignore labels for things, but at home, really hone in on those functional activities and teaching those functional words like help and open, more, things like that. Another thing is to model language. I know this is something at my house. My husband's very techie. He's on his phone or his computer all of the time. We have to limit screen time. It's hard. My kids watch movies too. It's important for them to be able to check out sometimes. However, when the kids are on the screen, we want to make sure that we're engaging with them. So one of the first shows that my kids watched was Mickey Mouse Clubhouse, right? It's cute, it's catchy, it's Mickey. That show interacts with the kids. It asks some questions. The kids can point at the screen when they ask questions. I would sit with my kids and watch the show and talk about what we see. So we want to make sure that we're modeling language as often as possible. Yes, sometimes we need to check out as parents. Yes, dinner has to get made. Those are all okay things, but we want to make sure that we're not on the screen 24/7. We also want to make sure that we're providing consistent and simple language for our kids that have difficulty with language. As when I joke a lot when I come home, sometimes my husband will tell me, I'm a grown up, talk to me like a grown up, because all day long I'm using simple sentences and easy to understand language. So we want to make sure that we are not using sentences that are super long and overwhelming. We want to make sure that we're, for example, if we're giving the kids a direction and they're having a hard time with receptive language and understanding things, when my kids come home from school, I'm going to say, hang up your backpack. I'm not going to say, hang up your backpack, take your notebook out, put your lunchbox on the counter, and then come tell me about your day, because they're done. They're not listening to all that information. Will we get through all of that stuff? Yes, but I'm going to give them a direction one at a time. If the goal that they're working on in speech therapy is to follow two-step directions, I'm going to give them two-step directions. So that's where you want to be in collaboration with that child's therapist, so that you can make sure that you're supporting those goals at home. But making sure that we're using simple commands, especially if they're frustrated or overwhelmed coming home from school, they're exhausted. We want to make sure that we're not using, overwhelming sentences and directions for the kids. A great activity to participate at home is some shared book reading. You can introduce a lot of great vocabulary. There, you'll find some interests that the kids have. There might be, being able to look at a book together and doing simple things like find the picture of Mickey Mouse, or having the kids tell you what things are called in the book. You don't have to read the books word by word. I use a lot of picture books in therapy and at home with my kids, so that we do more talking about what we see and not reading. Some of the books, if you look at like a Dr. Seuss book or some books that are very common kids books, there's a lot of language in those books. So I may read part of a page and not all of it. So sitting down and reading, there's a lot of great language that comes out of that. And then another great tip is to get moving. We see that physical activity really supports kids and getting their words out and being able to work on a lot of those functional language kids. So it's starting to get warmer, get outside, swing in the backyard or at the park. You can work on some of those functional skills like push or my turn. And that vestibular activity, this is one of the things I've learned from all the great OTs I've worked with. All of that movement really helps stimulate language. So getting outside, getting into a pool, all of that physical activity really helps foster speech development. So of course, everybody also wants to know what should I have at my house? There's so many toys and so many, we have great grandparents that like to buy my kids all of the toys. Too much is too much. So that's the first tip is if the kids have access to everything at home all the time, it's overwhelming. So we want to make sure that we've got the right kinds of toys and that there's limits to it. We know that choice making is hard with a lot of our kids. So if we have a choice between 2 or 3 things or a choice between 20 things in a bucket, we want to make sure that we're giving them success and giving them just a couple of things to pick from. That being said, rotate them. If you've got a lot of stuff, I tend to put things in bins in the basement, and then every season we'll get new things out so that there's always something new and fresh to keep high interest activities. Some of these are, very easy to have around the house. Things like I said, picture books. I try to limit the books that we have that have a lot of language and really keep, my first word type books. Or there's a series called No David, and those are great. They're just picture books with 1 or 2 words on the page that are really high interest for little kids. Having high interest sensory toys. Access to those are extremely important for their sensory needs, but then we can also use that for language. So for example, this picture I have down here with the squishy fidgets, we might want to be able to teach kids, if they like those squishy fidgets, get a couple different kinds, different colors, different shapes. This one has different textures. And then the kids can say, you can ask them, which one would you like? And they can tell you, I want the yellow star, or I want the bumpy one. And being able to work on different language skills through that choice making activity is good for the kids that can make some of those choices. Some cause and effect toys are really great. It works on those social skills. So if we're thinking long term, we want the kids to be able to make conversations back and forth. That actually starts in cause and effect toys. They push a button and something happens. Eventually they'll learn, I ask for something, and then I get something. So those cause and effect things build on each other. So bubbles are a great cause and effect. We blow and then we can pop. This top ball popper one up here is, we've got 3 of them at my clinic. It's a fan favorite. You push the button and the balls, get to spray out and it plays music. So anything where you can push a button and something happens is really great. You can practice things, taking turns with those, or just that cause and effect. Same thing with some of those very simple turn taking games. Those are early skills that eventually will build on so that we can have some conversations. So this one down here is called Jumping Jack. Another popular one is Pop the Pig or Pop Up Pirate. These are all games that you do one thing and then you can pass it. Eventually we would build up to games like Candyland or some of those little more complex, but these are nice one-step games. In this bunny game that's in the picture here, you put a carrot, or you take the carrot out and then you pass it and you would say my turn or your turn. And then the bunny hops out when you pull the carrot that's in the correct hole. So it's got some of that cause and effect and some high interest. The kids love when things pop out of things, or that surprise element. But you can really work on some great conversation skills back and forth and some turn taking skills back and forth there as well. So like I said, kind of wrapping up some of the big takeaways is that functional communication is extremely important for our kids. And like I said, communication happens for everybody all day, every day. It's something that touches everyone. So we want to really make sure that we're pulling in a speech therapist to support that development of our kids as quickly as possible. So that's all I have here. Yeah. So I'd love to answer any questions that anybody has. I know that's a lot of information. Like I said, speech, we're in a lot of different pots. So there's a lot to take in. So I'm happy to answer any questions that anybody has.
I just wanted to comment, Natalie, that I had forgotten that you guys worked on feeding issues too. And I learned that when Bianca was in early intervention, and I couldn't get her onto cereal, and
Sure.
she didn't sit up, so she got into early intervention, and I was like really surprised that like a speech therapist and like they like were desensitizing her mouth like with a sponge on a stick, and it was
Yep.
like a huge process. So I had completely forgotten about that, and I just think that that's something that you don't realize until you hear it, that is something that a speech therapist can help with.
Yeah, absolutely. Yeah, we started when I was in hospitals. I would start with newborns and just getting them to latch or to learn how to suck. That's something that a lot of kids don't have. So there's a lot of different parts of feeding. And it, like I said, it can be from that functional component up through, some sensitivities or some texture issues or things like that. So it's definitely sensor trained. I would say that it's not something that most speech therapists work on. So you want to, if you're looking specifically for feeding, that's one of those areas that you really want to make sure you have somebody with experience. There are also some occupational therapies that work on some of the like more sensory defensiveness feeding issues as well. That's one of those areas that we kind of overlap, but yeah, it's a very critical piece for a lot of families, and I think a lot of families don't know where to go with that. So
Right, so I'm glad you brought that up. So
yeah.
Oops. Sorry, I realized I was on mute. Any other questions?
Okay. So hi.
Hey.
I have a question about how we could get like on the speech therapy for autism. Like yeah, he's nonverbal.
Okay. How old is he? I saw him bumping around in there a little bit.
He's here. Here he is. Sam? He's 8.
Okay, great. Is he in school?
Yeah, he's in Park
Okay.
School, Evanston. Yes.
Great. And does he have speech therapy at school?
He has speech therapy, yes.
Good, great. So that's a really good, go ahead. I was gonna say, it's a really good starting point is to get the school therapist involved. One of the things I didn't mention when we talked about different places is you can access services in more than one place. So we do see a lot of kids that have speech therapy at school that also get private therapy as well.
Yeah, I hope like because he has medical card, like a lot of them taking this
Yes.
medical card. So he has order from doctor. I
good,
hope
okay.
like, you could help him because I like your experience, the ways you talking.
Yeah.
It's very like I get a lot from your meeting
good.
today, to be honest.
Yeah,
Yes.
I'd be happy to share my contact information and we can talk about like specifics, for you guys as well. Whether we can support or some recommendations depending on where you live and things like that as well. We can support.
Like we could contact you. Are you in Illinois, Chicago, Illinois?
Yeah, so my clinic is located in Plainfield, Illinois.
Where?
In Plainfield?
Plainfield.
Yeah.
Okay. Do you mind if you email me, please, your address, phone number? I could contact with you directly.
Yeah, absolutely.
We could bring the kid or.
Yeah, what I can do, I'll pop up. I've got my contact information on this screen. I don't know if you want to like try to take a picture of it, or Rachel, is there a way that we can?
Rachel, please, can you please email me the contact information?